Following new restrictions on healthcare providers and clinics receiving Title X funding, Planned Parenthood announced this week that it would withdraw from the federal program. This is Healthcare Triage News. Title X is a federally funded family planning program that's been around since 1970 as part of the Public Health Service Act. Its funds make reproductive health care available to low-income individuals who would otherwise have to forego such services. These services include cervical and breast cancer screenings, testing and treatment for sexually transmitted diseases, birth control, and contraception education. In some rural settings, Planned Parenthood is the only option people have when they're in need of these services. A new rule from the Trump administration forbids healthcare providers who receive Title X funding from referring patients to doctors who can perform abortions. They can still provide abortion counseling and may provide the names of providers who offer comprehensive services, so long as the majority do not offer abortion services, but they are prohibited from specifically identifying the providers who offer abortion services and from providing related referrals as a form of family planning. Doctors at Planned Parenthood can also still provide abortions, but only in clinics physically separated from where all other services are performed, and they cannot refer their patients there. Rather than comply with this rule, Planned Parenthood and other smaller Title X recipients have decided to withdraw from receiving these funds. Though Planned Parenthood receives federal funding from other sources, the potential effect of losing Title X funding spreads well beyond abortion referrals. In 2016, Title X funding used by several health centers enabled 720,000 pap smears and almost 1 million breast exams to be performed. Planned Parenthood health centers serve over 40% of patients using these services. Though Planned Parenthood is challenging the new rule in court, the change has been allowed to take place while the legal challenge is ongoing. In response, Planned Parenthood and other Title X organizations initially chose to stop using the money without officially withdrawing from the program. However, the Department of Health and Human Services required grantees to submit to an assurance and action plan documenting steps to come into compliance by August 19th, essentially forcing withdrawal from the program for current noncompliance. The United States Court of Appeals for the Ninth Circuit declined to stay this deadline until legal challenges were resolved, and thus Planned Parenthood chose to withdraw from the program rather than comply with the new rule. Without these funds, many women may be forced to simply go without basic health appointments that would otherwise provide not only prevention of unintended pregnancy, including the over 400,000 annual teen pregnancies, but also life-saving exams for early detection of cancer. Additionally, considering that investment in family planning programs like Title X reduces Medicaid-related costs, loss of these funds has an economic impact as well. Sure, Planned Parenthood could have kept the money and simply complied with the new referral rule. However, forcing physicians to withhold medical information and options from their patients runs counter to medical ethics. It also impedes open conversations between a doctor and a patient, which is a critical component in effective healthcare. Did you enjoy this video? You might enjoy this other Healthcare Triage news on how abortions are down thanks to birth control. We'd like to thank our research associate Joe Sevitz and our Surgeon Admiral Sam, and like them, you too can support the show at patreon.com/healthcaretriage. And you can support me personally by picking up a copy of my book, The Bad Fruit Bible.